On Tuesday, many gathered for the monthly opioid awareness meeting at the Eagles in Marlborough to hear Harvard Medical School Director Dr. John Kelly talk about the science behind addiction.
Addiction is a disease of the brain that affects the neurocircuitry of different functions in the brain, particularly reward, impulse control, judgment, memory, motivation.
90% of adults with addiction started before age 18, 50% before age 15.
About 90% of disability, disease, and premature mortality between ages 10 to 24 in this country is to do with alcohol and illicit drugs.
Addiction is without a question a complicated disease, but Dr. Kelly says thankfully it is both treatable and preventable. Through the Addiction Free Futures Project in Massachusetts, Kelly is helping to expand screening of substance use among teens at public schools.
It costs $2.5 million to implement it in the first year. One of the questions is, well, that's a lot of money. How are we going to pay for it? What's interesting, and I'll show you this in a minute, is how willing we are to shell out money to pick up the wreckage.
As you can see, alcohol and drug use is one of the highest costs in terms of lost productivity, healthcare, and criminal justice costs.
The olive bar is actually the amount of money that is spent on that disorder on prevention and treatment, okay, relative to the overall costs. So if you look at alcohol and drug use problems, as I said, we're good at sweeping up the wreckage. We'll shell out hundreds of millions of dollars to no problem, clear up the wreckage. But to actually treat it and prevent it, 7% goes on that relative to, and again, these are very stigmatized disorders.